How to use the ventilator. Ventilator use. An intubated patient will be connected to a ventilator breathing circuit. A patient that is not intubated may receive supplemental oxygen via a nasal cannula, in which they will be connected to the O2 outlet on the left side of the device. Ventilator cartridge and breathing circuit. The ventilator cartridge is intended to be used with a circle system to provide positive pressure ventilation for patients that are intubated. MOVES SLC recycles exhaled oxygen. This cartridge is made up of CO2 absorbent material to remove CO2 from any inspired gas. The cartridge is for use with the ventilator breathing circuit, which includes the ventilator hoses, the patient filter, the endotracheal tube connector, Nafion tube, and the sampling line. The cartridge is also for single patient use only. It should be discarded when an audible or visual alarm is triggered, indicating a high level of CO2 on inspiration. The alarm panel on the MOVES SLC display will indicate Inspire CO2 high, change cartridge. Failure to change the cartridge when prompted will lead to inadequate ventilation for the patient. Do not remove the clear plastic binding on the ventilator cartridge. Always check the expiry date on the cartridge before use. Installing the ventilator cartridge. Lift the cartridge door release latch and open the cartridge door by pulling it forward using the plastic handle on the panel. Ensure that the ventilator scrubber liner is installed. Insert the cartridge into the cavity. Press hard to ensure it is fully and securely seated. Close the cartridge door and push it in firmly, then depress the cartridge door release latch to lock it. If the door does not close smoothly, the cartridge may not be properly seated. Open the door and push the cartridge in further and try again. Replacing the ventilator cartridge. If, during operation, the system is advising the user to change the ventilator cartridge, remove the cartridge from any packaging and have it readily available for insertion prior to making any changes to the system. On the user interface screen, navigate to the setup screen and change the mode to monitor only to stop ventilation. Remove the water trap from the From Patient port to allow the ventilator cartridge door to open. Open the ventilator cartridge door and remove the depleted ventilator cartridge. Install the new ventilator cartridge, then close and lock the ventilator cartridge door. Reconnect the water trap to the ventilator cartridge door and ensure ventilator breathing circuit patient hoses remain connected. On the user interface screen, change the system mode back to ventilate to immediately resume patient ventilation. Installing a breathing circuit. Ensure that the ventilator cartridge is inserted into the MOVES SLC. Connect one end of a Nafion tube to a sample filter on the Y-piece. Use the butterfly lure connector to connect the Nafion tube to the sampling line. Attach the other end of the sampling line with a sample filter to the gas sample port on the MOVES SLC Patient Connections panel. Unplug the hose covers on the hose to patient and hose from patient ports and attach the water trap to the From Patient port. Attach the ventilator breathing circuit patient hoses to the water trap and the To Patient port on the ventilator cartridge door. Replacing the ventilator filter. The ventilator filter is a user-serviceable component that must be periodically replaced if it becomes damaged or compromised, or as indicated in the operator's manual. Locate the ventilator filter cover on the MOVES SLC. Unscrew the thumb screw and lift the ventilator filter cover. To remove the filter, press the filter frame down while turning it counterclockwise. Discard the filter in accordance with local regulations. Install a new filter by pressing the filter frame into place and turning it clockwise. Tighten the thumb screw. Replacing the CO2 scrubber liner. The CO2 scrubber liner, also known as the ventilator liner, is a user-serviceable component that must be periodically replaced if it becomes damaged or compromised, or as indicated in the operator's manual. Open the ventilator cartridge door and locate the CO2 scrubber liner. Fold the liner in slightly and grasp the edges. Pull the liner forward until it is out of the cavity and discard it. Place the new liner on the middle tube, orienting it such that the water collecting cavity is at the bottom. Push the liner back until it is fully seated. Ensure that the inspiratory hole matches the corresponding liner hole. Delivering supplemental oxygen. Locate the O2 outlet port located on the left side of the MOVES SLC. Open the protective cover of the O2 outlet port by pulling it up. Locate the O2 outlet sampling adapter and connect the green flexible tubing end to the O2 outlet. Attach the sample line filter that is connected to the Nafion tube to the O2 outlet sampling port located on the O2 outlet sampling adapter. Use a butterfly lure connector to connect the sampling line to the Nafion tube. Then connect the sample line filter at the end of the sample line to the gas sample port on the patient connection panel. Attach the nasal cannula line to the metallic outlet on the O2 outlet sampling adapter. On the setup screen, configure MOVES SLC to operate in O2 supplement mode.